Can you smoke or vape while on Suboxone? Can you? Yes. Should you? Most likely no, but the answer is in black and white. So let's take a look at the chemicals involved in smoking, the complexity of co-occurring addictions, the health risks of smoking, and options for treatment whenever you are ready to stop. Now, as a review, Suboxone is a combination of buprenorphine and naloxone that plays a pivotal role in opioid addiction treatment. This combination helps manage withdrawal symptoms, deter intravenous misuse, and reduces opioid cravings. Nicotine, the addictive substance in cigarettes and vapes, acts on the brain's reward pathways, similar to opioids, but through a different mechanism. Most often, people will feel more calm, relaxed, or even energized after smoking. When someone regularly uses nicotine, the body adapts and becomes tolerant, which can lead to the need for more nicotine. This dependence can lead to withdrawal symptoms when nicotine use is either reduced or stopped. Nicotine dependence is also reinforced by the habit of smoking or using tobacco in certain situations like a smoke break at work or managing stress. This creates a complex addiction that sometimes can be challenging to actually overcome. Now, individuals with substance use disorders actually have a higher rate of cigarette smoking than the general population. This correlation can be attributed to factors mentioned above. Now, the core occurrence can actually complicate addiction treatment as managing one addictive behavior may influence the other addictive behavior. Smoking is the leading cause of preventable death in the US and the numerous diseases linked to it. Vaping has actually been associated with around 2,800 cases of what we call e-cigarette or vaping product use associated lung injury. And because of this has resulted in about 68 deaths since February 2020. Vaping can also worsen respiratory conditions like asthma and COPD, and this can actually increase the healthcare costs for the patient. So now let's talk about the nicotine impact on Suboxone itself. Nicotine has vasoconstrictive effects, which constrict the blood vessels in the body. This is relevant for Suboxone, which is typically administered sublingually. Nicotine-induced vasoconstriction in the mouth could, theoretically, reduce the surface area available for Suboxone absorption, potentially impacting its effectiveness. I typically tell my patients to avoid smoking at least 1 hour after or 1 hour before their dose of Suboxone. Now, as mentioned earlier, nicotine dependence while undergoing treatment with Suboxone can sometimes complicate the treatment process. On the one hand, considering the risk of associated smoking and vaping, smoking cessation can be a goal for individuals on Suboxone therapy by using supportive, non-judgmental approaches that involve sometimes counseling and even additional medications for nicotine cessation. Now, on the other hand, this is not an all or nothing approach. The provider should assess the trade-off and the risk associated with either the continuance of or the discontinuation of smoking in that patient. All in all, while there is no direct contraindication to smoking or vaping while taking Suboxone, it is advisable to consider cessation of these habits as part of the overall strategy for health improvement and the successful addiction recovery. This approach should be empathetic and individualized and acknowledge the complexities of addiction and always the importance of whole person care.